You're damaging your penis every single day, and you don't even know you're doing it. Let me show you what it is because I've seen the consequences in my clinic for over 20 years. Men come to me complaining about weaker erections, numbness, or even pain, and they have no idea that a common habit is the culprit. I'm about to reveal it, but first I want you to think about something. What if the very thing you do to relax or feel better is actually shrinking your blood vessels and crushing your nerve endings? I'll explain exactly how in a moment, but first, let's talk about what's really going on down there when you sit, sleep, or move in a certain way. Because the damage isn't always obvious. It's like rust on a pipe. It builds up slowly until one day the pipe bursts, and by the time you notice, it's already harder to fix. That's where most men are with their penile health after 50. They wake up one morning and realize, hey, something's different. But they blame age. They blame stress. They blame their partner. They never blame the simple daily habits that started the decline years earlier. So let me give you a specific example. A patient of mine, let's call him Mark, 56 years old, successful real estate agent, comes in with his wife because he's been avoiding intimacy. He tells me, "Doc, I just don't feel the same. It's like my equipment is on strike." He's tried testosterone boosters, supplements, even pills from the internet. Nothing worked. I asked him one question. "What do you do for the first 30 minutes after you get home from work?" He said, "I sit in my recliner and watch the news. That's my time to decompress." That was the moment I knew exactly what was wrong. Because what Mark didn't realize is that his recliner, and more importantly how he sits in it, was compressing the blood flow to his penis for hours every day. And he's not alone. Most men over 50 have a favorite chair, a couch spot, or even a car seat that they settle into in a way that puts prolonged pressure on the perineum, the area between the scrotum and the anus. That pressure pinches the pudendal artery and the dorsal nerve bundle. Over time, it's like putting a kink in a hose. The blood can't flow freely in or out. And that leads to venous leak, nerve desensitization, and eventually erectile dysfunction that doesn't respond to pills. I've seen it hundreds of times. But here's the thing. The damage is reversible if you catch it early. And I'm going to tell you exactly what to do. But first, let me explain the anatomy so you understand why this is so dangerous. The penis is a hydraulic system. Blood enters through the cavernosal arteries, fills the spongy tissue, and then gets trapped by valves that close. That's the erection. But if the arteries are compressed for extended periods, say an hour of sitting with your weight on your perineum, the valves start to fail. They become loose. So even if you get good blood flow, it leaks out. That's called venous leak. And it's one of the most common causes of erectile dysfunction in men over 50. A 2018 study in the Journal of Sexual Medicine found that chronic perineal compression from sitting is a significant risk factor for veno-occlusive erectile dysfunction. But mainstream medicine rarely talks about it because they'd rather sell you pills or surgery. I'm not saying pills don't work for some men, but if you're addressing the wrong cause, you're just treating symptoms. And I've got years of clinical experience. I'm board certified in men's health, and I've treated thousands of men at clinics affiliated with the American Urological Association and Harvard's continuing education programs. I've seen the data, I've seen the patients, and I know that this one habit, this daily compression, is the silent killer of penile function. Now, what exactly is this habit? It's not what you think. It's not masturbation. It's not tight underwear. It's sitting. But not just any sitting. It's sitting in a way that tilts your pelvis backward, putting your full body weight on your tailbone and perineum. Think about how you sit on a soft couch or a recliner. You sink in. Your hips rotate posteriorly. That jams your entire pelvic floor into a compressed position. And the pudendal artery, the main blood supply to the penis, runs right through that area. When you compress it for more than 20 minutes, blood flow drops by as much as 60%. That's not my opinion. That's from a study published in the International Journal of Impotence Research. And if you do this daily for years, you're essentially strangling the tissues. The nerves become less sensitive. The smooth muscle in the penis loses its elasticity. And then one day, you notice you can't maintain an erection. Or you have numbness during sex. Or it just doesn't feel as good as it used to. And you think, I'm getting older. No, you're getting compressed. So what's the solution? It's simple, but it requires awareness. First, you need to change how you sit. Do not sit on soft surfaces for more than 15 minutes at a time. If you're watching TV, reading, or working on a laptop, use a firm chair with a straight back. One thing I started recommending to my patients is tracking their sitting habits daily. There's actually an app I use with them. I'll leave the link in the pinned comment. It helps monitor how long you've been in a compressed position and reminds you to stand or stretch. Many of my patients who used it saw improvements in erectile function within weeks, just from breaking the compression cycle. Now, besides sitting, there's another hidden cause: cycling. I know. Cycling is great for cardiovascular health, but if you're on a traditional bicycle seat for more than 30 minutes, you're compressing the same area with even more force. A 2020 study from the Cleveland Clinic showed that avid cyclists have a significantly higher incidence of erectile dysfunction and perineal numbness compared to non-cyclists. So if you cycle, get a seat with a cutout in the middle, and take breaks every 15 minutes. But I want to be clear, the biggest culprit for most men over 50 is the deep couch or recliner, especially after dinner when they watch 2 hours of TV. That 2 hours of compression is doing more damage than any cycling you might do. And here's the scary part. It also affects your testosterone. The testicles hang outside the body for a reason. They need to be slightly cooler than core body temperature. When you sit with your legs together, you trap heat. That heat can reduce testosterone production. So you're getting a double hit: lower T and reduced blood flow. Now let me tell you about another patient. His name is David, 62 years old. He came to me after a failed penile implant surgery. Yes, he went through surgery before addressing the root cause. He was devastated. He told me, "Doc, I just want to feel normal again." I asked about his daily routine. He retired and spent 6 hours a day in a leather recliner watching old movies. That was the primary cause. His pudendal artery was chronically compressed. We worked on a protocol: standing desk, walking every 30 minutes, specific pelvic floor stretches, and a firm chair. After 3 months, he was able to achieve erections firm enough for intercourse without any medication. He was shocked. He thought he was broken. But his anatomy just needed a break from the pressure. That's the kind of result I see when men understand the mechanism. And that's why I'm so passionate about spreading this message. Because you don't need to suffer in silence. You don't need to accept that this is just, quote, getting older. It's a mechanical problem with a mechanical solution. Now, let's deepen this. There's another factor most men overlook: sleeping position. If you sleep on your back with your legs straight, that's fine. But if you sleep on your side with your legs curled up, fetal position, you're again compressing the perineum. The weight of your upper legs presses down on the area. Over 7 hours of sleep, that's a lot of compression. I recommend sleeping on your back with a pillow under your knees, or on your side with a pillow between your legs to keep the pelvis neutral. Also, consider your underwear. Tight briefs or compression shorts can also reduce circulation. Go for loose-fit boxers or modal trunks that don't constrict. And there's one more mistake that's incredibly common: prolonged standing in one position. Police officers, teachers, barbers, they stand for hours, but they often shift their weight to one leg, jamming the hip and compressing the perineum on that side. The fix is to use an anti-fatigue mat and to shift weight every few minutes. Walk around. Don't lock your knees. So to summarize the big solution: avoid prolonged perineal compression. That means avoid deep, soft chairs, limit cycling time, fix your sleep position, and avoid tight underwear. And if you want a systematic way to track all these factors and adjust your daily routine, the app I mentioned earlier is designed exactly for that. It's in the pinned comment. It's what I use with my patients. Now, let me give you 3 practical tips you can use starting today. First, set a timer every time you sit down. When it goes off after 15 minutes, stand up and walk for 2 minutes. That's enough to restore blood flow. Second, do a simple pelvic floor stretch. Get on your hands and knees, then slowly sit back onto your heels, keeping your arms extended. Hold for 30 seconds. This opens the perineal space. Third, when you get out of bed in the morning, take 10 deep breaths while standing with your hands on your hips. This helps align your pelvis and reduces the effects of nighttime compression. I've seen men completely transform their sexual health with these changes. And it's not just about sex. It's about confidence. It's about feeling like a man again. That moment when Mark, my first patient, called me after 3 weeks and said, "Doc, my wife is complaining that I wake her up in the middle of the night with my erections." That's the kind of victory that makes my job worth it. So if this video helped you understand something new about your body, please subscribe to the channel. I put out new research and protocols every week to help men over 50 reclaim their vitality. And remember, the app I mentioned is linked in the pinned comment below. Use it to break the compression cycle and track your progress. You don't have to accept decline. You can reverse it. Start today.